thank you very much for joining us today and welcome to this national learning event on embedding trauma-informed and responsive organisations, systems and workforces. My name's Kathleen Winter and I hold the post of Child Health Commissioner in Ayrshire and Arran, and I work very closely with my fellow Child Health Commissioners across Scotland, and we have a shared goal to advocate and support the health and wellbeing of infants, children and young people across Scotland. And this collective leadership and connection is something that I value greatly, both personally and professionally, as it's these relationships and connections that really make a difference. And that also transfers locally to the community planning partnerships and the connections and relationships I have within my own health board area. And I'm sure that will resonate with each and every one of you that have joined us here today for this learning event. I'm absolutely delighted to have been asked to chair this learning event today, because we all know that trauma is a common experience across society, and by working together we can consider this across the life course and make a difference for the communities in which we live and work. So, just to get us started, you'll all be aware that the Scottish Government and COSLA have a shared ambition for a trauma-informed workforce and services across Scotland. And the hope is that these would be capable of recognising where people are affected by trauma and adversity, and also to be able to respond in ways that prevent that re-traumatisation or further harm and support recovery. And in turn, that will help address the inequalities and improve life chances for all our population and our community across Scotland. You'll also be aware that over the last 4 financial years, the Scottish Government has provided additional funding to all of our 32 local authorities in Scotland. And this really was with the aim to support us locally in embedding a trauma-informed and responsive approach across our services, systems and workforces locally. We're going to unpick that in a bit more detail today and see exactly what that means. And I'm absolutely delighted from an Ayrshire perspective that my colleague Angie Pinkerton was the first trauma-informed practice officer to be recruited, and she's going to share her journey with you later on this morning alongside some other fabulous speakers who are here to share and learn from each other. So, a bit of a background to today as well. You'll be aware that there have been some national learning reports published, and the Improvement Service have developed some of these national learning reports to share the learning that is emerging, the impact that we're starting to feel and see, and opportunities and also barriers from the work that are happening across our local authority areas since the funding began. And I think we need to be very realistic that whilst there are opportunities and lots of fantastic work taking place, it's also really good for us to get together collectively to have those courageous conversations to look at where could we support each other, to look at some of those challenges that we're facing, because they won't probably be unique to an individual, they'll be widespread, and to see how collectively we can support each other and continue to drive forward this really important agenda. Alongside the funding, the Scottish Government have also published follow-up evaluations of the National Trauma Transformation Programme in the local authority delivery trial areas. So these would have been in Argyll and Bute, Glasgow and Midlothian, and they did produce an interim 2021 evaluation report. So hopefully you've had a chance to look at these reports and be aware of some of the content of it, but we will have some more discussion as the day progresses. These evaluation reports identified challenges and enablers across local delivery sites, and they captured learning and reflections, and we're going to touch on some of these today as well. And finally, the National Trauma Transformation Programme Workforce Survey in 2024 presented the findings from the survey carried out with the workforce in Scotland, exploring the awareness and attitudes to psychological trauma and trauma-informed practice. And I think every one of us on this call recognises the importance of the workforce, because as a workforce, we're also the community and the population across Scotland, and we're all in this together is the message that we should be embracing. So that is a lot that I've just said, and I guess just to pick out some of the key points from that, today we are going to reflect on the progress and the impact of the work to embed trauma-informed and responsive organisations, systems and workforces. We're going to share and promote learning from local and national areas and organisations, and we're going to reflect on the recommendations and the next steps for Scotland. And here together, we want to concentrate on how collectively, all of us in this room, all of us in this space, by being here today, you're showing your commitment to work together, and we're going to really pull on that as the morning progresses.